Chiropractor Dr. Gregory Johnson, and we have Amy in here with us this morning. And Amy's parents brought her in for me to examine her spine and determine if she has any subluxations or misalignments in her spine affecting her nervous system, because she's been having some neck pain, some mid-back pain, upper back pain, and also some lower back pain with pain down into her right foot. So you are 10 years old?
Yes, sir.
Right now? So this is the very best time to get under chiropractic care. Her parents are very smart for bringing her in, so we're going to show you how we're going to check her today. Let's have you flex your head forward and backwards. And then normal. Keep your eyes closed. Do it again, please. And keep your eyes closed. Okay. You're a side sleeper, aren't you? See your head's forward and to the right. Do you see how it's the right?
Yes, sir.
Yep. Okay, your hands are kind of out in front of you here, so that's why your shoulders are rounding forward a little bit. Okay, so sit right here and face that way for me. These are called orthopedic neurological tests. I'm going to push down, Amy. You tell me if this hurts anywhere.
No, sir.
Okay, I'm going to go backwards now and to the right. Does that hurt anywhere?
No, sir.
You sure?
No, sir.
Okay, how about I'm going to go back and to the left and down?
No, sir.
Okay, if I tilt your head this way, does it tighten up anywhere?
Yes, sir.
Right there? Okay, if I do this, does that make it better, same, or worse?
A little bit better.
Okay, how about when you go this way, does that tighten up there as well?
Yes, sir.
Does this make that better, same, or worse?
Better.
Okay, if I do this, does that feel better, same, or worse to your spine?
Better.
Better? Okay, I'm going to push down now. I want you to resist, hold. Okay, and same thing here. I'm going to push down, resist, hold. Good. This is a chiropractic initial examination. It's called an orthopedic neurological examination. Just relax this. Got good reflexes in her biceps, her brachioradialis, and her triceps. And then we compare that to the other side. She's got good reflexes in her biceps, triceps, and brachioradialis there. Scoot back on the table just a little bit, please, Amy. And her patellar reflexes are normal. Just relax your foot in my hand, hon. And her Achilles reflexes are also normal. Very good. Okay. Let's have you lie on your stomach now with your face up in here. Now, I've already done this part of our examination, but I'm going to do it again to show you. In checking her leg length, her right leg is shorter by 1/2 an inch in the prone position. As I bring her legs up, you can see it actually gets longer on the right side, and that tightens up in your low back, doesn't it, Amy?
Yes, sir.
Yep, so she's got a right SI joint subluxation right there. Is that tender to touch?
Yes, sir.
And also right there, huh?
Yes, sir.
That's the left SI joint. So her sacrum is deviated too, and I'll show you. I'm going to have you lock your legs straight and lift your whole right leg off the table. No, the whole thing, huh?
Oh.
Lift the whole leg up. Nope, keep it straight and lift the whole thing straight up. Okay, now relax.